to introduce and to welcome the Honourable Dustin Duncan, the Minister of Health, to the Spring Representative Assembly. This will be Minister Duncan's fourth time speaking to this audience. We've been privileged to have him. Last fall, he was the first person to get his flu vaccination at our flu clinic at the RA. Minister Duncan, we have no plans to stick you with a needle today, but we're thinking maybe you'd prefer that to answering more questions about lean. In May 2009, Premier Wall appointed Minister Duncan to the Saskatchewan Cabinet as Minister of Tourism, Parks, Culture and Sport. 3 years later, in 2012, he was appointed as Minister of Health. The SMA Board of Directors had the pleasure of meeting with Mr. Duncan yesterday and had a very candid and productive conversation. It's good to know that our priorities are aligned and that we're both working towards a more sustainable, responsive healthcare system that serves the needs of the people of Saskatchewan. Please join me in welcoming Minister Duncan now.
Good morning, and thank you very much, Claire, for the introduction. It's great to join you once again at the Spring Representative Assembly. I'd actually lost count that it has been 4 times already that I've been privileged to speak to you as Minister of Health. I also do want to make a quick thank you of the Ministry of Health officials who are here this morning with us. I was at the back of the room as we were going through the introductions, and it's pretty clear that we are outnumbered, but not by that much. So I want to thank all the Ministry of Health officials who are here this morning with us. Dr. Kozorowski, I want to thank you for inviting me to join you here this morning, as well as the opportunity that we had last night to meet with the Board of Directors. I very much appreciate the strong relationship I believe that we have between the Government of Saskatchewan, the Ministry of Health, and the Saskatchewan Medical Association. Our government very much values what you do and knows how much you improve Saskatchewan's healthcare system, and I'd like to thank every one of you for your commitment to our patients and your commitment to patient and family-centered healthcare. That's exactly how we started our journey to transform the healthcare system, with the conviction that the patient comes first. As you know, our desire to put patients first is driving quality, safety, and service improvements throughout the entire healthcare system. Physicians are on the front lines in providing quality patient-centered care and are vital participants in transforming our healthcare system here in Saskatchewan. The last few times I've addressed your assembly, I've spoken about the importance of physician engagement and leadership, and I'm convinced that this is fundamental to any and all real change that we'll see in the healthcare system. The SMA continues to be an important partner in bringing about the dramatic changes we're seeing in our healthcare system. And it's evident and very clear that physicians have played and will continue to play a huge role in helping us to achieve the many successes that we have for Saskatchewan patients. It's only with your support that we can transform Saskatchewan's health system into one that is truly patient-centered and a model for others to see. The Saskatchewan Surgical Initiative is a great example, I believe, of better meeting patients' needs, and I want to thank you for your excellent work in helping us reduce wait times for your patients. The Saskatchewan Surgical Initiative has made remarkable progress since 2010. As you know, at that time we had some of the longest wait times in the country. Now, 80% of patients in the province are offered a surgical date within 3 months of seeing a specialist. There are 11,000 fewer patients waiting more than 3 months than there were when the surgical initiative began. As of January 31st, 2014, 5 health regions have 0 patients waiting more than 6 months. Saskatoon and Regina Qu'Appelle have made strong progress, but we know they encountered challenges that meant that they would not fully achieve the target by March 31st. But we do expect Saskatoon to meet the target in the fall and Regina Qu'Appelle to do so by March of next year. A number of other improvements and initiatives are on the front burner right now, as we phase away from the surgical initiative, but always reminding ourselves that we cannot lose the progress that we made on the surgical initiative. The provincial health budget this year focused extensively on areas where physicians will provide strong leadership. As many of you will know, work is underway to improve emergency department waits and patient flow as a health system priority. Our goal is that in 3 years, by 2017, no patient will wait for emergency department care. Obviously, I don't need to tell you that this is a very ambitious goal. But I don't believe that we today in Saskatchewan are afraid to set aggressive targets and have made success and have shown success by moving incrementally towards longer-term goals. Both Regina Qu'Appelle and Saskatoon Health Regions have already made remarkable inroads in tackling different aspects of this challenging issue. Physician involvement will be crucial to the success of this ambitious goal. One way to help relieve pressure on emergency departments is a pilot project called Hotspotting that we're funding in this year's budget. The initiative is to connect patients who aren't today well served by the current system with the appropriate services outside the emergency departments. In the coming year, we'll launch pilot programs in Saskatoon and Regina to target assistance to high-risk, high-use patients who repeatedly show up in the emergency departments. This innovative approach to meeting complex patient needs will advance the work already underway on ED waits. And it will also help us meet the mental health and addiction support needs of Saskatchewan people. This past spring, we committed to developing a comprehensive action plan to increase patient access to mental health and addiction services. Dr. Fern Stockdale-Winder, the commissioner leading this important work, began meeting with physicians and other stakeholder groups last summer. And I look forward to receiving the plan's recommendations later this year so that we can advance quality health care for Saskatchewan residents. We're also focusing on strengthening our primary healthcare system. One way that we are doing this is through new models of care in rural and remote communities. Collaborative emergency centers are open 24 hours a day, 7 days a week, and provide stable, predictable access to primary and emergency care for patients in rural centers. These centers use a range of health professionals working to their full scope of practice with physicians as key team members. This past fall, the first CDCs opened in Maidstone and Shaunavon, and in the coming months, others will open in Spiritwood, Wausau, and Kenora. Physicians have been very important in developing the framework that supports these CDCs. Physicians' involvement and leadership continue to transform our health system in other successful initiatives. Now, Claire mentioned lean in her introduction, and of course, I probably couldn't be here this morning and give a speech to you all without mentioning lean, and so I'll do that at this point. I certainly believe that we're seeing in lean quality improvement projects and encouraging results. At its heart, lean is about improving patient safety and quality of healthcare. We know lean is making a powerful difference to patient care, to health workers' environments, and to the health system as a whole. It embodies our commitment to putting the patient first. With the SMA's support, we introduced a Lean Leader certification process last fall designed specifically for physicians. And I'm very encouraged to see that 40 physicians have taken or are in the process of taking Lean certification training, and hundreds more have completed Kaizen basics. I think this speaks volumes about the value that you see in quality improvement and your commitment to improving patient care. As you know, we've heard a variety of opinions on lean. I think that this type of rigorous public debate is valuable. It's important that people understand why we are trying to improve quality in our health system and how frontline providers can support system improvements. And it's vital that we know what physicians and other health providers think so that we can address your concerns. This morning, I want to make a special mention and recognize your outgoing president for her leadership role that she has assumed in the debate about quality improvement. Claire has, with, I believe, a clear and clarion voice, articulated the risks to patients and long-term sustainability if we don't make concerted effort to change delivery models and processes. Claire, your leadership has gone a long way in advancing a strong patient and family-centered healthcare system in our province, and I thank you for that. Part of of developing a patient-centered healthcare system involves appropriateness and accountability. Without that, we couldn't affect any lasting change. This year, we will begin to consult closely with physicians and other providers about clinical appropriateness, and we'll be looking to physicians for their leadership and their involvement. In all of this, physicians will lead the way in providing the right care, provided by the right provider, to the right patient, in the right venue, at the right time. I also recognize the CMA and the SMA presidents are encouraging physicians to use the Choose Wisely project, a first in Canada initiative that addresses this very issue. Another continuing priority of the Government of Saskatchewan is the area of physician recruitment and retention. As our province grows, and as all of you will know, we're now at 1.1 million people, 100,000 more Saskatchewan residents in just the last 6 years, and that is continuing to grow. As the province grows, attracting and keeping new doctors in Saskatchewan is especially important. And I think we've seen a lot of success in this area. In fact, the physician workforce has grown by more than 400 physicians since 2007. Yet, as we know, there are still challenges, both in rural and urban areas. To address our province's needs for physicians, we've introduced a number of initiatives. For example, our incentive program provides $120,000 in funding to recent family medicine graduates who establish practice in rural communities. We've established a rural physician locum pool. More international doctors are coming to Saskatchewan through a new assessment program for internationally trained physicians. More physicians are being trained outside of our larger cities through distributive education. We recognize that physicians who experience practice in smaller communities perhaps are more likely to stay for the longer term. Work is underway to stabilize and strengthen the College of Medicine so it assumes a greater role in supporting doctors in the future. And we continue to work with the SMA through our agreement and with SaskDocs on the recruitment and the retention of physicians in all areas of the province. These and many other initiatives being developed and implemented within the health system are aimed at improving patients' access to healthcare services and physician workload and work-life balance. In addition, I'm looking forward to completion of a physician resource plan later this year. As our population grows, as our demographics change, and as our care delivery models evolve, this plan will help us understand where to better focus our recruitment and retention efforts. I'm particularly grateful to count on the support of Randy Weeks, the Minister of Rural and Remote Health, to address this and other issues around rural and remote access to healthcare. There is no question that there are challenges ahead, but we have seen incredible progress and improvement. The healthcare system is undergoing significant changes as we refocus our efforts on putting patients first. Together, we are working towards common goals: better health, better care, better value, and better teams. I know that this is a commitment shared by the SMA and by individual doctors here in Saskatchewan. I appreciate your leadership and look forward to working with you on transforming the healthcare system for the betterment of all our patients that we serve. Again, I want to thank you for everything that you've done and everything that you will continue to do to improve healthcare for Saskatchewan patients and their families. And with that, I'd be pleased to take your questions. Thank you.